Promptly helping an injured animal before, while you try and get more help from an NGO or from a veterinary hospital, it is important that there are certain things that you can definitely do, and each one of us can do. With whatever limited resources we have, we can all do that. Little bit of knowledge, skill, and common sense is all that is required to do the first aid and to be able to save a life. Okay? And this definitely helps. A lot of these things, we will talk about the different kind of treatments or different types of emergency situations and you will find out that there are a lot of those things which you can just treat on site. Instead of waiting for an ambulance to come and then making sure that the animal is transported safely, getting the due treatment in time, to avoid all of that delay, if you do a first aid, you will be able to help cure, save a life for sure. Why it is important? So it preserves life, it preserves the condition from worsening, as one of you said, reduces trauma, reduces aggression, promotes speedy recovery. Now, emergency situations when a first aid is a must. So these are some of the situations, but please feel free to add in if you've seen some other situation around you. So when an animal, and I'll be referring to dogs and cats in this presentation, but if you have a question about anything else, any other animal, just feel free to speak about it. So when an animal is not breathing or having difficulty breathing, has collapsed, is not responding, is bleeding excessively, or you see seems like a broken bone, there could be a fit or seizure, or seems like vomiting, or you see something unusual, it seems where the dog or the cat may have eaten something toxic. There could be a snake bite, vomiting, or passing diarrhea for 24 hours. So some of you who've been maybe closely like interacting with dogs or cats while you're doing feeding or some other volunteer work, so you would have noticed there would be a wound or maggot wound, ticks and fleas, skin diseases, heavy bleeding, coughing, ear and eye infection, burns, and fractures. These are some of the things that people who are out on the feeding rounds or who are regularly volunteering or interacting with the community dogs and cats, they identify these as the major issues that they deal with in emergency kind of a situation where they need most help. Like these are the most common ones also that are there within the community dogs and animals. Now, so when, let's say you've got a dog who's in distress, so it is important. Sometimes the dog will come in your hand and is so unconscious that obviously won't react to anything that you're trying to do, like if you're trying to stop the bleeding or anything. But for some dogs which are conscious and who won't let you touch, it is important that you have somebody around you to help you out. And it is important to muzzle the dog so that you don't get a bite or something. And that bite is not going to be like they want to really hurt you, is because they are in so much of pain and distress that they want to save themselves right now. And they are not sure whom to trust and whom not to trust. So it is important, just for safety, you can muzzle the dog. Okay. But if you are a regular, like you regularly go out and interact with community dogs and animals, most often the dogs would know you and will let you touch. And if you're trying to do a bandage or trying to clean a wound or things like that, most often they let you do that without a muzzle. But it is important to learn how to muzzle. Like if you see a dog with a wound, you clean it with a betadine liquid. Okay? You do not use Dettol or Savalon. Dettol is not for dogs. Dettol is not for animals. Okay? We use betadine liquid to flush out anything and clear out that wound space. Okay? Now after that, you can put spray, either Scavon spray. I have it here. I've got it here. I hope you can see it. Are you able to see it? I think I've
Yes,
got the
ma'am.
video on. Yeah, so there's a
Yes,
Scavon spray. This is the mildest of all. There are other variants as well, like the Topicure and a few others. But this is the one which is the mildest. So which means, when I say mildest, that it won't really irritate the skin. It's the mildest. But sometimes, and most often what happens is the dogs really run away with the spray sound. So you have to make sure that you're feeding the dog while you're trying to spray. Okay, so that the dog, at least it's right there and the dog has also had the meal, because otherwise they're not going to come back till next day because they'll be so scared of the spray noise. So you can spray, that's one. If you're able to handle the dog, manage the dog very well, then what you do is you clean it with the betadine liquid and then there's a Scavon tube as well that comes, or a Hemax tube that comes. I will show it to you. There is a black tube that comes. So Scavon spray or a Hemax ointment that comes, or Scavon ointment that comes. Once the betadine is done, you put the ointment, and on top of that you put Neosporin powder, which you can easily find in a normal human pharmacy as well. Okay. Now these things, after that, it is important that you don't bandage it. Most of these wounds does not require a bandage, so you leave it as is, but also follow up with the antibiotic course, which you can pick up. You can consult a vet, and I can also suggest an antibiotic, but I don't want to do that because I'm not really sure how many of you are really experienced in handling antibiotics. So this has to be followed up, like the wound that you see in the picture. This has to be followed with a minimum 3 to 5 days of antibiotic course with some supplements. Okay. Now what will that do? It will like dry up the wound from the top, the topical application you've done, and you can do it once a day, because what happens is it's very difficult to find dogs 2-3 times a day and complete cleaning the wound, applying the ointment. They won't come back after one application. So it is okay even if you're able to do it once a day and follow it through with the antibiotic course. Okay. And sometimes, like, some of the queries that we get is, but we are not able to give antibiotic every day. Ideally, it should be done every day, but trust me, having done it for many years, whenever you see the dog, give the medicine. So the dog may come back next day, so you may miss out on one medicine for one day. It is okay. Do not panic. It's fine. It will do some good to the dog for sure. Try and giving the food of the whatever they like mostly chicken rice or whatever they like. Try and incorporate. You can add haldi in it. Haldi works. It's like a home remedy, and it works. It's antiseptic. Works like a magic. Okay. So you've done the topical application. You've given the antibiotics, and you've ensured that there is a good food, preferably high protein diet or whatever you can prefer, or you can arrange. Give that to the dog. Okay. And follow it through. It will heal. You do not have to send the dog with this wound or a bigger wound than this to a shelter. You do not have to. You can do it yourself on the ground. But some of the things that you have to make sure is that you're not using Dettol, okay, and you are following the hygiene when you're doing the betadine. You're applying betadine or you're applying any ointment, and you're consulting a vet for antibiotic course. All right. And trust me, within 3 to 5 days, a wound like this will be completely cured. Now, how a wound gets maggot invested. So once, let's say it's an open wound, there are fleas, or an untreated wound, and that leaves a lot of eggs and leads to maggots. Now, maggots are nothing but most like little insects that eat up on the wound. And that is the stage that we really want to prevent. And you all will be able to do that with the first aid that we have shared with you. Any questions on this?
No, ma'am.
Ma'am, just one clarification here. Ma'am, you have said that after doing a topical creaming of the wound, we don't have to apply the bandage on that. So in that scenario, how we can prevent the wound from the flies or unwanted insects?
See, the application that you've done, the spray or the ointment, I'll find the ointment, I have it here only somewhere. So this will help. this won't let the fleas enter the wound. This is the cover. This is the cover. Because I'll tell you why not to bandage it. Because the dog will be, one, is already in distress because of the wound. It's paining and it's uncomfortable. Dogs don't like anything to be tied. They will really go they won't be comfortable at all if you tie something around. And sometimes the wounds, and you, as most of you would know, wounds are mostly at a very uncomfortable spots. It will be near a thigh where it cannot really hold. It will be near the elbow. It will be difficult. And wherever you tie it, they will just tear it apart in few minutes. Unless you have a dog who's very nice and docile and can sit in the one corner till do whatever you want to do, but I won't open the bandage. They will open the bandage, which means they will remove the medicine as well, which you've applied. So best is either you do the betadine ointment thing, or you do a simple spray. For most of the dogs who you're not able to catch hold of, or they won't even stay for any medical help, just simply apply the spray. But forget about the betadine also in that case. Just apply the spray. Now, maggot wounds, as we said, there are flies and then there are insects that eat up the wound. So there are sometimes what happens, because the dogs come from one colony to the other, and then nobody's really caring. It's very difficult to catch hold of the dog also, to send them for treatment or do the treatment. So what you need to do is, if you see such a dog, if you can apply, Topicure spray that you see is a variant of Scavon spray only, but Topicure actually, and there is one more DMAG spray that is super effective. DMAG spray, I have that in the first aid list as well. Now Topicure, in my list of priorities, I have always kept it last, because this really irritates their skin, and this really hurts them. So I have always kept it as the last option. So you put the spray, you put the Negacent powder on that. It's a small bottle, and you put that. This is the bottle that I have. This is the Negacent spray. This you put on the maggot wound. Okay. Again, you don't have to bandage it. You have to leave it open. Then you follow it with a course. If there is a bleeding, you do the antibiotic course. Otherwise, you also do the ivermectin course. Okay. Numac and Numeth are the medicines. But now, it's very important for all of you to know that ivermectin is poison as well. So, if you do give it without a vet's advice, if you give it, you will find it. You will be able to get it from a vet clinic. But must understand the dosage as per the body weight, as per the severity of the condition from a vet. It is extremely important, because if you give an overdose of ivermectin, which I say even 2 tablets when it's only 1 tablet required, you're going to kill the dog. So it is very, very important that you consult a vet and then only follow the ivermectin course. So ivermectin is a medicine which you can either break it and put it directly into the wound as well, 10 ml, and also you follow it in the oral. Now, in the oral, you do not have to give it every day. Even doctors won't suggest to give it every day whenever they prescribe. They say, okay, 3 days in a week, or once in 5 days. So, or once in 15 days. It's like that kind of powerful medicine. Okay. So, but what you can do, if you see a maggot wound and you don't want to even go the ivermectin route, but there is a severity case. So what you do is you put the spray, you put Negacent powder on top of that, okay, and then give a good high protein diet to the dog. At least with that, what will happen is, and find out a painkiller from the vet. Give that to the dog. At least the pain will subside. The dog will be coming back more. You'll be able to do more treatment. And then maybe 1 or 2 tablets of ivermectin may be required. It would be required for sure, but without sending them to a vet, you will be able to manage it on your own for sure. Okay. Now we've written it here that take the dog to vet ASAP. Yes, But we all know, having been around dogs, it is very difficult. The reason the dog got maggots in the first place is because, one, maybe people didn't observe it, didn't care, or second, it was difficult to catch the dog, which happens very often. So it's very difficult to catch the dog and send it to a shelter or a veterinary clinic. So if it's possible, great. If not, Topic Cure, Negasen powder and the ivermectin course, you do it, it will heal. The wound will heal. It may take some time, but it will heal for sure. A wound like this, if you start a course, it will be healed in 15 to 20 days maximum. Because see, I don't suggest, as a first aider, you should not think that, okay, my first aid method is that I should send every dog that is in distress to a shelter. Not required. The whole idea of first aid is that you do certain steps to make sure that you do the on-site treatment. Sending it to shelter will only worsen the situation, because one, shelters are over-flooded. Second, they will catch infection because their immunity is low, they've already got a wound, and they will catch more infection, and that may lead to untimely death. So it is important that we do these steps, and these things are easily available on a vet clinic or a pet shop, and you can find it, and you'll be able to apply that. Okay. Ticks and fleas. So this is another thing that we've heard over the period of time, that dogs generally are like, ticks and fleas happens, and because of which they get a tick fever, and tick fever is fatal. Just like many other major diseases, tick fever is really, it can really get dangerous, and it's fatal. So there are certain things that you can do. Now, on dogs, you can put Nortex powder, but it also depends. See, when you're doing a tick and flea treatment, it's very important to identify that, are you trying to give first aid to a pup or an adult dog? Okay, because there are certain things that you cannot apply to a pup. And a pup who's near a mother, for sure, you have to make sure you have to consult a vet if it's a nursing mother or a pup who's like not even a month old or 2 month old. You have to consult a vet, because whatever you give, it will get in, they won't be able to take that strong medicine or any kind of treatment. Also because, and the nursing mother, you cannot give an antibiotic or anything to a nursing mother, because she's milking, and therefore it can be dangerous for the kids, for the pups as well. Okay. So if in case of a pup or a nursing mother, and it's a case of ticks and flea, so just consult a vet. But what you can definitely do is, if you see an adult dog, you can definitely spray some Nortex powder. Even on pups, you can spray Nortex powder, but not to a month or a 2 month old. Okay. Then there is a Bayer Wolfo powder. These are the powders which are easily available, and powders are gentle. So you do it neck down. You never do it in eye and ear. None of the medicines that I've suggested, like the spray or the Negasen or powder or the Neosporin powder, it has to be neck down. It should not go into the eyes or ears. That is very important. Okay. Now, Freedom spray is very effective, and you apply that from neck down to like a dog which is 4 months and above. From the neck to the tail. So neck to the tail, you apply that. It's a spray. It stays effective, because see, the community dogs, they catch ticks and fleas because of the fact that they are out in the surrounding, they're out in the bushes, they're out in the woods. So that's how they catch ticks and flea. And there are certain medicines, but they are super expensive to prevent a tick bite, and it is not practical to give it to every street dog possible. But these are some of the things that you can do. Okay. There is also Fiprosoft Spot On. Again, these sprays, the Spot On that you see here, it should not be applied to a pup which is less than 4 months of age. Okay. Recently somebody reached out for a query because they applied this Spot On a 2 month old pup. So, and obviously the skin got a lot of rashes. So we should not do that. There's neem oil. So some of the home remedies that I personally follow over the years, and it really helps with the street dogs as well, is neem oil. You don't have to really apply proper with full hands. You can just simply do some drops near the neck, near behind the ears, near the tail, and under the arms. These are the major spots where there is no air circulation. That's where they get the ticks and the fleas most of the time. That's where they get infested. So you can apply neem oil, eucalyptus oil, drops of that, rosemary oil. These are super effective. And also you can add, again, it's a home remedy. It's a gandhak, it's called, and sulfur in English. And you can just put a little bit of that in their food every day. Just a little bit, a pinch of that every day in their food. That also helps prevent ticks and fleas. It just prevents, which means they're out in the woods, but they're not going to catch it. They're at a very low risk of that if you add these little things in their food. So mange, scabies, and fungal infection. These are the three major types of skin diseases that most community dogs are prone to. And they are mostly infested by mites and fleas, okay, or a yeast infection or a bacterial infection. Now, tell me about mange, or tell me if somebody wants to share if they've seen a dog like this, the picture that you see, and were you really what did you do with this kind of dog? Because this is a very common, unfortunately, a very common sight, especially I can say for Delhi NCR, and unfortunately, such dogs get people think that, okay, they have rabies. We'll talk about rabies as well. But this is definitely not rabies. This is a skin issue. And most often people call MCDs and NGOs, oh, there is a rabies dog. And when you go, you realize that, okay, this is simple, a dog who's really irritated with this excessive itching and is suffering from a mange skin issue. It's very important because most often the dogs, the community dogs are staying, again, the ticks, and they're very prone to ticks and flea because they're out in the woods. So it is important that you identify the right kind of skin issue. Most often you see that the hair are getting removed. There is no hair, or some kind of bleeding is happening, or because of excessive itching, scratching, they've got some wound. So mange is one such skin issue that community dogs go through, and that is caused by mites. What you would see is redness, excessive itching. It's so much so that this is the picture, this is the condition that they get to. Okay, leading to hair loss, sores, lesions, scabby and scaly skin. But this is not rabies. This is mange skin disease. This is treatable. This is 100% treatable. Early on, the better it is. The moment you realize, you notice, you observe a dog like this, you start the treatment. It is fine. It's only in the older dogs it gets difficult, because the treatment that you're going to do is of ivermectin, which is anyways a very powerful medicine, and the dose have to be administered by a vet. So it is important. So mostly in the older dogs, like older when I say 10 plus, 11 plus, old dogs, it gets little difficult to cure 100% of mange, but in younger dogs, it is 100% curable. Okay? And it's an ivermectin dose that happens. If there are any wounds that happen because of this excessive itching, then antibiotic course will also be followed for them. Okay? Now, scabies is another something that we see very often in community dogs. So it looks like something like this. Has anyone seen a dog like this? Again, scabies is a type of mange, and it's a highly contagious skin parasite. So even it is, see, in mange, excessive itching leads to hair loss because they're just not able to manage it. But with scabies, if you have a little patch on a dog, it will spread. So the early detection is critical. It's important, and it also happens because of mite infestation. Most often as a treatment, what vets do is they take a little skin test. They do a little scab and the little swab that they take, and then they do a test how bad it is. And then they start the ivermectin treatment, antibiotic treatment, because in these cases, most often they will be bleeding. It will be itching, so they'll be itching so bad that there'll be some kind of bleeding. So it's important. And all the things that I'm sharing so far, it's a breed dog or a no breed dog, all ages, all breeds. Okay, this can happen to any dog. So this happens because of a bacteria infection. It is not contagious. It won't spread to humans at all. And some of the symptoms that you see is regular itching. It mostly happens near the wrist area, near the ankle. These are some of the areas in the ear. Flaky, crusty skin that you see around the dog's nails, and wherever the skin is folding. So breeds like, if we talk about breeds, then breeds like Spitz, Pomeranian, Terrier, and Pugs, they are very prone to any dog which has a lot of folds or a lot of hair and then the folds, then this happens. So how would you identify a fungal infection? You will see like a circular thing, like a ringworm kind of a thing on the skin, and a regular excessive itching. It will be slightly pink, but you won't see the hair coming out. You won't see like a scabies kind of a thing on like a patch on the skin. It is like a simple regular itching you will notice in your dog, and little pink area it will be. Okay, and most happens for street dogs. It happens mostly in the ear. Most often they get ear infection because of this bacteria, and then they will start tilting their head. So if it's in the ear and it's an ear infection, they will tilt their head because it's uncomfortable for them, and they'll continuously keep scratching their ear. Okay, so all of this is treatable, 100% curable in early stages. If it's a pet, so you give them a lime sulfur. There is a solution that comes, lime sulfur, easily available on vet stores and Amazon, and you give a weekly wash of that. Okay, and keep the dog in the sun. Or you can apply a coconut sulfur solution as well. Sulfur is again gandak, the yellow color powder, and just apply it. It just helps soothe the skin, because obviously it causes a lot of irritation over a period of time if not treated in time, and this is how the dog will start to look. E6 lotion, super effective. It's a spray and a lotion as well. It's a pink color lotion. It's super effective. I've seen in all dogs, especially outside dogs, because it's very difficult to catch hold of them every time for a treatment. So it's best that you find some of these things which are like, even if you do once in 1 week, it will help. Okay, at least the further spread of whatever the infection that they're going through. Kiss skin lotion, and then there is a dusting powder, antifungal dusting powder is also there. All these things are easily available on vet stores. The first two things, coconut sulfur, you can find it on a grocery store as well. Antifungal dusting powder, again, that prevents itching, and it helps feel the dog comfortable, because nobody likes like regularly have to itch, and it's very uncomfortable for a dog. It can lead to a lot of irritation. There is a Petmosol soap that comes. Neem oil, again, you can, if it's a pet and a skin disease you're going through, like you're facing a skin disease issue, one of the things that's very effective is that you boil some neem leaves in hot water, and once the water is cooled down, you wash the dog with that neem water. It is very effective for ticks, fleas, and the general conditioning of the dog as well. And you can apply a little coconut oil before giving them a bath. This is for the pet dogs. Okay, because it's very difficult to catch hold of a dog and forget about giving a street dog a bath. It's tough. Okay, then third one is the coconut oil and the sulfur that I've mentioned. Okay, obviously in all these situations, my suggestion would be that on these skin treatments, you talk to a vet, start the treatment immediately. But if you don't see it getting better, and use your judgment. You're the best judge because you are there with the dog. Okay, don't go by hearsay. That's very important. Go by your judgment. And if you see that the wound or the skin patch or how it was and now it's getting worse, it's got some pus formation or it's got something else, then try and take the dog to the vet or call a para vet. And then you call an ambulance and take the dog if possible. Okay. Now we go to excessive heavy bleeding. This happens in accidental cases, right? So in accident cases, it's very, very important that you stop by and check the dog. The dog would be excessive bleeding or it will be in trauma. Okay, so do help the dog. If you're not sure, then you rush to take the dog in an auto or wherever, whichever vehicle possible, to the nearest veterinary clinic or hospital. Now, if there is an external bleeding, you will know immediately. So you apply pressure on the area for 3 minutes. Sometimes you're not sure where the blood is coming from because maybe it's lying in a pool of blood, but it's breathing heavy. So you try and wrap the dog, okay, and immediately rush to the vet because excessive blood loss can lead to loss of life. Okay, now internal bleeding, there are very few areas like the nose, mouth, coughing. If they're coughing, then that you know there's internal bleeding. But sometimes what happens in an accident, obviously the jaw or anything is fractured, then that can also cause some bleeding from the mouth because of the teeth and other gums got injured. But if it's coming from nose or mouth, it's definitely internal bleeding. Again, if you rush the dog to a vet immediately to the nearest hospital, wherever possible, you can save the dog. It's so crucial. Like first half an hour to 40-45 minutes of that, like even 5 minutes is very important, but I'm saying the maximum also. Sometimes you see a dog lying on the road in pool of blood, you may think like, oh, he's not going to ab ye bachega nahi, so we don't do anything. But no, it's important. I have seen dogs like 40 minutes ho chuke hain, 1 hour ho chuka hai, accident hue. Those dogs can also been saved. Okay, so don't look away. That's important. Okay. Burns. Unfortunately, we have to deal with burns as well. So this happens in few situations during Diwali, around when we burst crackers. So the dogs, community dogs and cats, they can get a burn. Some people also, they're not very dog friendly, so they restore to these methods of putting hot water on some dogs around. So that also can cause some burns, some fire or some kind of a short circuit, anything of that sort can lead to burns. Now, you have to make sure that you restrain the dog. You don't let the dog run away because it's just going to make it worse. Apply cold water or ice pack to the burned area. Leave it for some time, but immediately take the dog to the vet. Why this is important? Well, because you have to call the ambulance. This requires a lot more treatment. But while you're waiting for a vehicle to come or ambulance to come or make that arrangement, you at least put the ice pack on it. Do not apply any ointment or butter. That is like an immediate, our reaction that we have a burnol, we'll just apply that. We cannot apply that. Okay, we cannot apply any butter or ointment. Okay, if burns cover large part of the body or is located where it can be licked, cover the area. Because see, the dogs or cats for that matter, they lick the area where they're feeling the pain or irritation. Okay, so it is like simply they try to lick the wound because that helps like soothes the area. It helps them give some kind of comfort, but it is not good for them because then the wound will never get dried. It is important to dry the wound with the medicines, and therefore we should prevent licking the area. But in the burns also, their immediate reaction would be to lick the particular section where it's burned, or to just try to pacify the pain. That's what they're trying to do. Okay. Now, if you're giving, if the dog is almost like half unconscious, then don't give anything. The maximum that you can do is honey, and that you put on the tongue. Okay. But you will not give any liquid or food item when the dog is almost in the lying position. If the dog is little bit conscious, as in like sitting position, in the sitting position, then you give like a salt sugar combination to help them gain some strength, like the ORS solution that we have for humans. Similarly, you just simply make one at home quickly with water, so a little bit of salt and sugar for them. Okay. So this will work as little SOS, but it's important to take them to vet immediately. Okay. This would require proper inpatient care. Okay. Then we have fracture. Now, most often the kind of queries that I get is a little bit of limping, any bit of limping, and people say it is a fracture. So one thing we all need to understand is whenever an accident happens, there is an impact, then the dog is in so much of trauma and stress, you can imagine. They anyways do not get up. They have difficulty getting up. So that does not mean that they have a fracture for sure. They may be trying to get up and then get down, but that does not mean that they have a fracture. That is purely 99% of the time, it is because of the trauma and the stress that they are not able to get up. Okay. So now how we can identify a fracture? It's only once the dog is little stable, you've cleaned the wound, you've cleaned the dog just to find out what all injury has happened. You see a bone, you touch it, and the dog will scream because that is the fractured bone. With the fractured bone, they won't be able to get up, they won't even let you touch, they will scream because they're in so much of pain. And you will see that the leg or the limb is broken. Okay. Also, you have to make sure that you don't put any, like I've seen some people, they put a little bit of wood and try to do a plaster on their own. You can't do that. First, we have to heal the wound. That is very important. Okay. And then you take, in that same position, you take the the dog to the vet, because then an X-ray has to be done if it's really a fracture or a nerve compression, because in a nerve compression also they are not able to get up because of the impact. But if it's a broken bone, all broken bones do not require a plaster. Okay. So the picture that you see here, this is one of my recent rescues. Her name is Ori, and she's 2.5 months old. She was run over by a vehicle on all 4 limbs, like very recently, a month ago. She's still with me. So all 4 limbs, okay? And she's got more than 8 to 12 fractures in both her legs and one arm. So it is important that, and she also has open wound, bone wounds, which means the bone has cracked open and then there is a wound. So you have to heal the wound first. Otherwise, it will lead to maggots. It will lead to other infections. And she's so tiny. She's just 2.5 months. No immunity, no vaccination. She's out on the street feeding on whatever she was finding. So we have to be very, very careful. Okay. You can treat like a fracture or a limping or a nerve compression on site, as long as you don't have to take the dog to a vet every time. Do one consultation and then follow up on the phone. But you have to make sure that you create a safe space for that dog in and around your home, where you can feed the dog regularly, give the antibiotics or the medicines or the multivitamins, because in this case, multivitamins are highly recommended. And also I want to tell you that if once the X-ray is done and you know that the bones are fractured in one line only, they heal up on their own, especially in young pups and dogs, cats. they heal up on their own. You have to just follow the multivitamin calcium process. If it's an aligned, they heal up on their own. So there is no surgery required. I know a lot of vets simply say opening is required, surgery is required. I have seen like, I don't know how many worse fractures, like where the bones are like all over the place in the body. I have never got a surgery done, but they're all healed up. They're living a good life. They can limp a little bit. They walk, run, do whatever, but they're limping a little bit. Obviously, there's a deformity, but the surgery cannot guarantee. So don't go for surgeries unless it's highly recommended. You've taken 2-3 opinions from 2-3 vets, because most often that's what vets suggest. Okay, this has to be done, 12,000 rupees, 8,000 rupees. Not required. Trust me, most often the fractures get healed. You just have to make sure you give a safe environment to a pet, to the dog, and just follow it on the medicines and the regular care. Okay. And in a pup like this, you can't send to a shelter 100%. You have to own it up. You have to help, because shelters, a pup of 2.5 months will 100% get infection. Okay, so cuffing is another, I'll move on. Then cuffing is another thing that we've seen, especially during the winter season, that you see that a dog is cuffing in a way that seems something is stuck in their throat and they're trying to take it out. That is the kind of voice that they see. That's the voice that you hear around. So it's a deep, dry, honking canine cough, and it could be a kennel cough. Kennel cough happens only when you are if a dog has been in a shelter or in a boarding where with other dogs and not vaccinated dogs. That's where they catch kennel cough, and otherwise it's a seasonal cough. So right now, what I've seen few of the cases, and I can share a little video with you. One of the dogs, the queries that came through, it is because of the winter or the monsoon, or it's a dry cough. When you see that something is stuck, it gets cured in 7 to 10 days, and there are certain medicines that you see. I have written it down. In kennel cough, it is contagious, so you have to keep the 2 dogs separate. That's why the pets that you see, they are vaccinated for kennel cough. Okay, but if they're vaccinated, then obviously it's not contagious, and you have to just make sure that you give a medicine, which is usually a cough syrup, for 5 to 7 days. Depending on the weight of the dog and the severity. Also, you have to also observe if there is a vomiting or other things that you observe in a dog, then you need to consult a vet immediately. Okay, which means like vomiting or very lethargic. There could be a fever as well, and they're just lying low. They're not eating anything. Definitely, then you need to consult a vet. Okay. I've written down few medicines on the screen that you can see. The first one, Jufix Herbal Cough Syrup. This is available on Human Pharmacy. This is super effective. 3 ml to 5 ml, depending on the body weight, you give, and within 3 days to 4 days, you will start seeing the cough getting better. And it's herbal, so it's made of all herbs, no side effects at all. Okay. I wanted to show you quickly the video of, let me see if I have it open. I was trying to open it. No, sorry, I don't have it here. Okay. Moving on to the ear infection. Now, it's because of the major vaccine that happens, and in the street dogs, you will see, because obviously they can't be groomed, they can't get their ears cleaned, and so that is why they catch this ear infection. Infection happens when there is it's because of it's moist, there is no air circulation, and that's when they develop this bacterial ear infection. 100% curable. It can, you can definitely make sure that it'll be cured. It's not contagious at all, not between animals to animal, dogs to dogs, or to humans. So some of the symptoms is like scratching, head shaking that you see. Also, they just tilt their head if they're in extreme pain. Sometimes a little bit of swelling around the ear. that you see that they're like not comfortable and feeling little low, so simply if you can clean, then there are certain solutions with which, but with street dogs, community dogs, it gets a little difficult to catch hold of them one and then clean the ear. It's another task altogether. There are certain ear drops that you can put. Ziplocs is one, but my suggestion and highly recommendation would be to check with a vet on the ear infection. You can send the video to a vet or a photograph of the ear if you can catch hold of the dog, or just generally maybe a painkiller to help subside the issue and help relieve the pain. So see, I understand it's very difficult to catch the dog, take the dog to a vet every time. Make sure that you take the video of this, whatever the condition is, so that you can communicate it better to a vet and tell them exactly how it is. Rather than we trying to articulate our interpretation, it's best to take a video or a photograph and share it with them. They will know, they'll be able to analyze better if it's really, and what stage of infection it is, and what is really we can do. That will also help guide as to what antibiotic course they have to follow. Okay? But we should not try to do it on our own if we are not very friendly or not comfortable handling a dog, especially the ear infection and eye infection. Now, eye infection, because it's the very sensitive area, and we definitely don't want to mess around. So this infection, again, you can put there are eye drops, but you need to consult a vet because it's very, very sensitive part of the body. You can definitely clean the surrounding area of the eye, but nothing in the eye without consulting a vet. Okay. Now, eye infection could be because of an injury, conjunctivitis, like where they develop a little bit of redness, little bit of cataract-like thing, which is like a blue or a white thing that you see in the eye. It could be distemper if there's a regular discharge. So it's important with an eye infection, look for these little signs of like swelling and discharge, and there's a pain or there's a swelling, a redness in the eye, and then consult a vet. Okay. Okay. So now we'll be moving on to the section where we'll be talking about some of the diseases that it's important for, as a first aider for all of you and as the responsible feeders, to understand the difference between these severe cases, okay, which often always get clubbed into rabies by default, okay, and to send the dog to a shelter. So that's what we're going to discuss. All of these are the information that we're going to share. It's important that you it's for your understanding. Nothing is for you to treat in any of these cases, like distemper, parvovirus, or rabies. You have to take them to a vet. But why we've included it in the first aid is because these are the cases that you most often see, like especially distemper and parvo in pups and in dogs around in the colony. Distemper and parvo are not contagious to humans. Okay, so let me just clear that first. Okay, and there are vaccinations for all of these three, and there are more. And it's all, that's why we always say get your dogs vaccinated, the community dogs vaccinated. And there is a 9-in-1 or 6-in-1 vaccination which helps prevent from any of these viruses. It helps save them from all of these viruses. Okay. Okay. Now, distemper is some of the symptoms that you see is sneezing, coughing, thick mucus coming from eyes and nose. There's a fever, lethargy. Now, how do you identify a fever? It's under the ear, on the joints, or on the tummy that you see. 102 is the normal body temperature. So they're warmer than us, for sure. But And 100, if they get 103, how will you know that they have fever? Obviously, their action, and they'll be very lethargic. They'll be sitting in one corner, not eating. Those are some of the signs that you see. But you can touch their, like, under the ear or the joints and the belly, and if it's warm, and you will really know it's warm when you touch it. Okay, then it is a fever. It could be 103, depending on the temperature that you feel. You will get an idea as to how bad that fever is. Okay, because if it's 103, the dog is still around and not collapsed. But if it's 104 and 5, then obviously the dog has to be rushed to the hospital immediately. And obviously you will physically also see the signs a lot more than that the dog is not stable. Okay. Now then there is fever. Yeah, sorry.
Ma'am, I have a question.
Mm-hmm.
There is a dog in my locality right now. He has a fever.
Mm-hmm.
He is at my home right now, and once our doctor suggested me that we can give him the tablets that we normally use in the humans. So can I use paracetamol for that or not?
No. If you ask me, the right information is no. But if there is nothing in the world that you can source, then yes. You understand
right
my
now,
point?
actually, the nearby hospitals or the veterinary shops are closed in my area, and I am planning to visit the Motibagh hospital. Okay.
So this is the medicine. It's called Hemfirin. This is by Himalaya, and this is available on a human pharmacy. This is for fever. So if you can buy, just try this. This is herbal also, but this is for fever.
Ma'am, what's the name?
Hemfirin. Can you see? I don't know. You can see.
You just spell it. I'll just post it.
H-I-M.
Just
Yes.
H-I-M.
P-Y. Papa.
P-Y.
P-Y-R-I-N.
Byron. That's it.
Hemfirin. This is by Himalaya, and this is for fever. If there is nothing that you can source, then you give paracetamol. But how big the dog is, that's also important. How big the dog is?
Ma'am, he is of about 2 years.
Okay, so you give 1 tablet of paracetamol if there's nothing, and then but you do take the dog to bed.
I will go for Hemfirin.
Yeah, but then also see fever. You have to find out what the fever is. If it's just one day seasonal fever, then you will see a recovery in by tomorrow morning for sure. But you see the dog is not getting better, it's getting worse, and there are other signs and symptoms that you start to see. Go for a blood test, take the dog to the vet, because it could be a tick fever, it could be anything else as well.
Yes.
Okay.
I've seen him today only.
Yeah, important thing is that the dog should not stop eating, no matter what the condition is, whether it's a wound or a distemper or anything. The dog should continue to eat, because if the dog has stopped eating, then it's a very severe critical stage. Okay.
Okay, ma'am. Thank you.
Yes. Yeah. So distemper. So these are some of the signs that you see. It's very important. As soon as you see any of these signs and symptoms, you take the dog to the vet. Now, distemper is contagious between animals to animals, so between dogs and dogs, and therefore it is very difficult, to find a shelter or an NGO who can really take in such dogs, because they don't often take distemper dogs in, because it's contagious. It can, it can easily spread, especially amongst pups, if a shelter has a lot of pups. So the best is that you take him to a vet, keep a secured, safe environment around your basement, wherever you can find. Create that little safe space for them, away from the wind and the rain, and do the treatment there. Treatment would require, if the dog is in a severe stages, would require regular IV, which has to be done by a vet. So you may have to take the dog to a vet 2-3 times in a week, or call a paravet who can come and do it at home. A paravet is nothing but a compounder, like we have in human, like an assistant vet, who can come and do it on the site as well, and just do the oral medication course. In first stages, early detection in distemper, it is curable, they can survive. But if it is second stage and beyond, chances are very bleak. Okay. Then moving on to parvo. Yeah, somebody has a question?
Ma'am, I've been meaning to ask you about seizures.
Yeah.
Ma'am, how do we really identify a seizure?
So see, seizures, like it'll come to you in a very layman term. If I can explain to you, it'll come like different dogs behave a little differently. But if fit is like the body is completely shaking, they're just like a fit that you see in a human being. That's the same sign that you see. Others could be disorientation as well. Okay? Disorientation, as in they're not sure and they're trying to bang the head against the wall or anything, trying to move somewhere. They're not able to move.
Ma'am, I had a dog. Actually, we lost him in April this year. Last year. Actually, we took him to the vet, but I don't think they could properly identify the reason for his illness or anything. We had blood tests, etc. But in the end, I think he had some seizures, and that period was strict lockdown period.
See, the seizures happen. So I took a pup yesterday. He had parvo actually, and I don't know if it's I needed some disturbance. I'm not sure if everybody can go on mute for a second. It's somebody's phone. Yeah, this is better. Thanks. So okay, that kind of seizure that you're talking about, that happens towards when they're about to lose their life. So sometimes what happens is that the dogs dies, they get a fit and a seizure attack and they pass away. So that is different. That is not the diagnosis of what really happened to your dog. So that is not, seizure happens. Like I took a pup yesterday, he had suspected parvo case, very critical, and he died of a fit attack. He had a fit attack and he died. So that was nothing to do with like he normally have a fit or a seizure, but seizures usually, if you're diagnosed, then that's the symptoms that you see that they will, but it's curable. Like you can reduce the episodes of seizures and fits with the regular medicines. It is because of the neurological disorder happens, but with the condition that you are sharing, I don't think so. The dog had a seizure.
Ma'am, then I think it wasn't regular seizures. It was just towards the end.
Yeah. So it happens towards the end. That is not. Towards the end, they go. Sometimes I have seen quite a few dogs who go with the fit. They get a fit, they get a seizure attack, and then they die. But they've had some other issue actually. That's how their body is trying to respond, and then they go away.
Okay, thank you.
Okay. So parvo again, very prone. Like pups are more prone to parvo because especially in the winter season, like it's crazy winters, crazy rainy season. You will see diarrhea. There's blood in the poop. There's fever, lack of energy, loss of appetite, weight loss, vomiting. Now, if you see, again, you'd have to take a parvo pup to vet. 100% curable, unless it's like advanced, super advanced stage. It is curable. Shelters do take it, but trust me, don't send a pup to a shelter. They will catch another infection, and because their immunity is anyways low. When you are getting any dog treated for distemper, parvo, or any other things that we've discussed so far, try not to get the dog vaccinated during that treatment time because the immunity is low, and with the vaccination, the immunity becomes a little low for next 15-20 days. So their survival becomes more difficult. So once the treatment is done, give a gap of 15-20 days and then let them be stable and then get the dog vaccinated. Because I know some people, what they think is, okay, abhi parvo ho gaya hai, so abhi parvo ka vaccination kara dete hain. But that is the wrong time to get a vaccination done. You have to get the treatment done. And parvo is also contagious between dogs and dogs, but not so much, not so fatal like distemper. Okay. And especially ये parvo के cases pups में दिखते हैं, जो separated होते हैं, mother से separate कर देते हैं काफी लोग, कि छोड़ आते हैं कहीं पे, तो वो बहुत जरूरी है. मदर से सेपरेट नहीं करना है पप्स को. The dogs which are separated from the mother less than within 2 months or on birth, they are more prone to catching distemper, parvo-like diseases, and especially with the breed dogs as well, like the pets. That's why we say 45 days से पहले pet pup नहीं लाना चाहिए घर पे. So it is important that protocol is followed, that you don't separate the pups. If the pups are within less than 1 month and they have parvo, you try and make an arrangement that you keep the mother or pups together, not isolated, and get the treatment started. Again, you can do the treatment at the vet clinic, or again calling a paravet and making a safe enclosure around your area. Okay. So rabies is contagious. Okay. And this happens because of an infection. They've got bitten by an infected dog. Okay, that's why they catch this infection. That is why we say it is important to get the community dogs. If you start feeding a dog, as soon as you're comfortable, get the dogs vaccinated for anti-rabies and all of these major viruses and diseases. Some of the symptoms that you see is excessive salivation, fever, seizures, paralysis, hydrophobia. There'll be fear of water. They won't want to see water. They want to sit around water, and the jaw is dropped and locked. Okay, and they will be running around helter skelter, like making a whining sound, crying sound, or just barking relentlessly. But when I say barking, that does not, because there are dogs that are often who bark a lot, who are active in the colonies, and people often mistake them as rabies dog or aggressive dog. It's not like that. Okay, so you have to be very, very careful. If you're not sure, take a video, share it with a vet, and quickly ask for what is the case. Okay, and so rabies is obviously, we have to save ourselves, so we should not try and get hold of the dog, try to secure the dog. We should not do that. If you see a rabies dog, you will call the local NGO or ambulance and send the dog away. Usually the rabies dog dies within 72 hours, but they won't start a treatment. They will keep the dog for 72 hours, 48 to 72 hours, and the dog will die if it has rabies. Okay, but a lot of the other conditions that we've seen, like mange, scabies, or aggression dogs, or barking dogs, very social barking dogs, or things like that, people call them rabies. So it is important. There's a very clear distinction. You will know for sure if you've seen a rabies dog. You will know for once and for all life, you will know that, okay, that is a rabies dog, because they have a very peculiar way. They'll run around the colony or the area, and they'll just bark. They're just trying to, just running away and barking, and there is saliva that you see. That's very, very common. Okay. So we will not try to save or secure a rabies dog. We will immediately report and call the ambulance. Okay. So you can call and say that there's a suspected rabies dog, please come and take, and nobody will say no to that, because they don't want anybody, any human or any other dog to get infected or get bitten or get affected by it. So such dogs are immediately taken away. Okay. All right. How much time do we have? Because I can skip some of this. Snake bite, I think I can skip.
Ma'am, can you finish it by 6 p.m.?
Yeah, sure.
Okay.
Yeah, there are just few other things and nothing much actually. We've covered quite a lot already. Now, okay, so let me quickly cover snake bite now that we are here. How many of you stay in a snake bite, a snake prone area actually? Which is like a farmhouse or I don't know if all of you are from Delhi NCR.
I mean, we have seen snakes in TTU campus, but not in my area,
Yeah.
Okay.
fortunately.
Okay. So in the campus, like, do you also have dogs, right?
Yeah, we do.
Okay. So yes, so then obviously if they're in a snake prone area, then there is definitely a high risk of getting a snake bite. But snake don't bite just like that. Like, they bite, or it's a reaction to an action. So on its own, they don't come to a place where there is a lot of movement. They don't come to a place where there are a lot of dogs. They themselves don't come to that area. Okay. But if there is, dogs are trying to catch hold of the snake, if they saw a snake, or some humans are trying to take away the snake or do something, then they get agitated and then they will react. So now in case of for a snake bite, there's intense pain, rapid swelling on the legs and face of the animal that you see on the dog. You will see the puncture marks, like we've seen it in movies as well. So that will be oozing out blood. There's just 2 marks. There is excessive drooling, rapid breathing, and these are some of the signs that you know that there is a snake bite. So you have to use restrict the blood flow, okay? Because but not with, like, don't have to tie it. A lot of people, what they do is they just tie it with a cloth, or they tie it with a bandage. We don't have to do that. We just have to keep press, because we don't want the blood loss to happen. And we will not try to do anything where we want to suck out the blood on our own. We obviously, if it's a dog and you see any of these signs, you take them to the vet. Simple. But don't tie it. Like, just put a loose cloth on top of it, but don't tie it. That is a mistake that most often people make, and take them to the vet. What you will also see are like a white liquid, मुंह से निकल रहा है, झाग निकल रहा है, that kind of a thing also. But if the dog is breathing heavy, there are chances of survival. And the sooner you take the dog or a cat to a vet, you'll be able to save. Okay. Now, first aid for dog bite. Let's say if you, God forbid, if one of you get a scratch or a bite. Let's say talk about a scratch, actually, where there's no skin puncture, but there is a little scratch and there is no skin, there's no bleeding, no blood. Irrespective of, you have to wash it thoroughly with a Dettol or a Savolon or antiseptic, and just wash it for 10-15 minutes अच्छे से. If you get a dog bite, skin has been punctured, there is a little blood, then you have to get the anti-rabies vaccination. In Delhi, we have Safdarjung Hospital, where in the emergency you can go anytime and get it done. Also, along with anti-rabies, you also have to get a tetanus injection done. My high recommendation is that people who are feeding dogs regularly or who are handling dogs on a regular basis get a tetanus at least once in 6 months for sure. And also you can get a pre-exposure boosters, pre-exposure vaccination as well. And you can get it from any hospital. You can just tell them that I handle dogs or I am around dogs a lot more. So I'm at a risk. So that is fine. You can just get a pre-exposure vaccination done. There are 3 doses of that along with tetanus. Once in 6 months or once a year also you can get. That just helps you because it'll trust me, I get it done and it helps me, it gives me confidence that okay, because I am saved, I'm secured, I've already got my vaccinations done. So I will just be able to help pick up any dog if there's a saliva or any condition. I'll be okay to do that. That just gives you a lot more confidence. Okay. And it's obviously for your safety. Also, as I mentioned all throughout, follow the hygiene, very, very important. One of the things that I've most often seen is there are cute pups. Pups are everybody finds them cute. We pick them up. Do not pick pups. We will be giving them infection. They are too tiny. They have no immunity. So please do not pick the pups. And always follow the hand wash regime, the hygiene when you're feeding the dogs or taking care of any animals around. Yeah. Now here few things that I've put down for first aid kit. And yeah. So DMAG is another spray. Actually, that DMAG spray is a yellow color bottle. Again, you get it from the vet store. That is very effective for maggot wounds. So if there is a maggots and wound, you just spray it. It's very effective. And liquid betadine, cotton bandage, neosporin powder, you will get it at a normal store. Himfrin, I've already mentioned, that is for fever. Digitone is actually for digestion. Sometimes you see that the dog has puked. You fed the dog and the dog puked a white liquid or yellow liquid or just whatever they ate. So for one time, you can give them a Digitone. Digitone is like a Digin that we have. If you see a recurrence of that, then you take them to a vet or consult a vet. And all the syrups that you'd give, it has to be 3 ml to 5 ml depending on the body weight of the dog. Okay, if it's like a 10 kg dog approximate, then 3 ml. Okay. Keep some multivitamins in your box, the cough syrup, also a food packet. So this is very handy. I'm just sharing. I hope you can see this. This is one of the pedigree pouches that I always keep in my first aid kit. This is very, very handy. And all dogs are happy to take a medicine in this or with this. Yeah. So yeah, and then a syringe. That's very important. Always, try avoid using the same syringe every time. It's for food. It's food or medicine. So always try and keep a packed one with you. That's very important. So yeah, it's a small kit. Whenever you go on feeding rounds, you don't have to say, oh my God, what do? I don't have anything. So as a practice, what you can start do is create this first aid kit. And if you or anyone around you who sees a dog in distress, at least they can contact you and you'll be able to help. There are a few other medicines that we've written here. Arnica, this is homeopathy. This is very effective. This can address a lot of issues. You can give it on a Parle-G biscuit, 5 to 10 drops to a dog who's in stress or pain, and it helps. Skin lotion, again, very mild lotion, helps with skin infection. And the last one that I'm not sure if you can see is Himalaya Live 52. So all the treatments that we do, obviously there'll be antibiotic course, and we should not be continuing course. Always check, because see, like if we cannot take antibiotics, we don't want to take antibiotics all our life. Same is for the animals as well. And that would also affect a high dose of any antibiotic. It will affect their liver and kidney in the long run, which means we are reducing their age by a couple of years. So we should always check with the vet. Should I continue with the antibiotics? Is it really required? Always check. No vet will say, oh, I know better than you. No, they will always appreciate the fact that you're taking so much of interest in taking care of a street animal. And Himalaya Live 52 is the supportive. It's a supplement that you can start. You don't need a prescription for this. You can start on your own. Once the antibiotic course is done, you take it from a normal pharmacy. It's a Live 52 for pets, for animals. And you give a 3 to 5 ml dose to a dog once a day. Give it for 10 days or 15 days. So just always be very curious to know what has happened to the dog. Talk to the vet regularly. Try to find out what is the real reason, and understand the medicines. The more you start understanding these medicines, these names, you will get more confidence. And when I say confidence, is to help, to approach a dog in distress. I'm not saying that we become a vet, for sure we are not, but yeah, we'll be able to more confidently help dogs or animals around us. Yeah, I think that's all that we had. Sorry, I had to rush through a few of the things. Here is a little vaccination schedule just for your reference. So, but for street dogs, my simple suggestion is get them a 9-in-1. Once they are off a treatment or they are healthy and stable, get them a 9-in-1 or a 6-in-1 infection, either one of them, and an anti-rabies, and follow it every year. For pups, they would need little more vaccination. But for adult dogs, you can definitely conduct these vaccination drives, take a help from a local vet around you. One more thing on deworming. Can anyone tell me about deworming? Deworming of pets? Okay, so deworming is actually, it helps prevent any kind of worms, tapeworms in animals like dog's stomach, which is the major cause of lot of these infections, whether it's a skin issue or anything. The vet will always recommend do the deworming first. So, and deworming is nothing. It's a very simple process that you all can do. For pups, it's a syrup, and for adult dog, it is a tablet, and you give it per the body weight. And in the deworming, you have to do it like once in 3 months. And that, trust me, if you do that regularly with your street dogs, community dogs, even your pet dogs, that you will see a lot of the issues like skin issues, infections, general fever, all those things will be taken care of. Okay? And so yeah, I think some of the things that I've mentioned below I've already covered. So yeah, I think that's about it. So never give antibiotics to a nursing mother or pups less than 3 months of age. Never remove pups away from the nursing mother unless it's really critical and a vet has advised you. Deworming is critical. It helps resolve a lot of issues. It should be repeated once. It should be done once in 3 months for dogs. You should always keep a first aid kit handy, and avoid sending a dog to a shelter for treatment, because I think that's the one thing that we really want all of you to be sure of and do that is whenever you see a dog in distress, unless you've done first aid is not sending them to a shelter. You're not helping the dog. Okay, so first aid is you try to comfort the dog then and there, and then look for help if it's not treatable. There are a lot of things that we've discussed today which is treatable on site and where you all can help for sure. Okay, so in case you have to take a dog to a shelter, monitor his or her treatment. Don't just dump them in a shelter and forget about them. Always make sure that you check on them, do a follow-up, find out what's happening and get them back to their location. Because no dog is safe in a shelter and they don't deserve a life in a shelter. Okay. Anyone has questions or any thoughts? Anything you would like to share?
So all of these, I mean, most of the diseases would apply to dogs, but do these also apply to other animals like cats or other pets?
Yes, it does. It does. But in big, large animals like buffaloes and cows and horses, there'll be a lot more. But in our community, we don't see them more often than these. So like if you see a cow injured with a wound, you apply the Scavone spray, you apply Negacin powder, you do the betadine, you do that thing, exactly the same thing.
Yeah, some of the things would be the same, but yeah, as you said that, I think as the body size increases, so does the complexity in the body, and hence and like there are a lot of more diseases that a cow or buffalo or a horse are prone to than dogs are not. So yeah, that's the complexity of it. Yeah.
Okay, anyone else? Question?
Ma'am, how many diseases are contagious from the animals like dogs, cats, and can you list them a few? Can you list a few? Like we can catch from them.
See, you can, as a human, you can only catch rabies if you're bitten by a dog, by a rabid dog. If you're bitten by a rabid dog, not a normal dog. If you get bitten by a rabid dog, then you can catch definitely rabies. Other than that, scabies, but only in the advanced stages of scabies, which is the skin issue, one of the skin issues that we discussed. That's it. Not coronavirus, not bird flu, for sure.
Okay, ma'am. Thank you.
Ma'am, what are the medicines we can use in deworming?
So deworming, I think I wrote somewhere. Yeah, so here. So these are some of the names I've mentioned. Drontal Plus is the medicine, is the best that we recommend, but there are others also, whatever you can get. And one tablet is equal to 10 kgs of weight. Okay, so let's say if the body weight of a dog, on a street dog, sometimes it's difficult, but you can just do a little guesstimate. It could be 15 kgs or 18 kgs, so you do 1.5 tablet or 1 tablet plus 1/3 tablet. So it's per the body weight, and you have to only do it once in 3 months. For pups, you have to repeat it in few weeks, but for adult dogs, Drontal Plus. And for pups, there is a syrup that comes actually, the Drontal, with the name Drontal Puppy. Okay. So that actually brings us to this call for action. And so what we would want all of you to do post this session is deworm healthy street dogs in your colony and record the date. It's very simple. You get these tablets for like 40 rupees, 30 rupees, 50, 60 rupees maximum. And you can just make it a routine to make sure like you pick up 5 dogs of your street and around immediate radius and start deworming them and record their date and share pictures and videos with us. Okay. Another thing we would request you to do is collate a list of all the functional veterinary clinics and hospitals that you see within your 5-kilometer radius. Okay, this is not as simple as taking it from the Google, but what you do is you find out what are the different vet clinics, pet shops, pet clinics that you have around your 5-kilometer radius and which ones are functional. What are their timings? Now sorry, that's my dog, sorry. Sorry, just 1 second. My husband has come, that's why this announcement. The vet clinic information that you get is important for the timing, whether it's functional, and because see, this will help you find out if there is an emergency. It will give you a lot more confidence that if you see a dog in distress, you know where to take them. You will know who's the vet. You know whether it's 24/7 open or not. Will they have a facility inpatient where like they can keep the pet for the night? Okay. And you can send us all of this information and we'll be able to post it on our social media Straws platform. And we'll definitely would love to post an appreciation for all of you if you do that. It's not too much of an ask. It's very simple, giving the deworming tablets and finding out the vet clinics around you. Do you think it's doable? I hope you had gained some information, some knowledge. We will be sending some part of this, obviously not the entire presentation. We will be sending you some basic things that you can keep in your first aid, the things that we've discussed, and hopefully that would help you. But we are really looking forward to your responses to our call for action, which is deworming videos or a list of all the veterinary clinics, as Vasanti ma'am said. So yeah, but it was great having you all, and thank you for being so patient.
Yeah, I would like to thank you, especially the Straw organization, for this event. I mean, I literally had zero knowledge about this. Like you would say that, like you said, especially for that snake poisoning part, that you just wrap the cloth, because that's what we have seen. But you mentioned a lot of good things, and it was very knowledgeable, and I thank you and your organization for that.
Thank you so much.
Thank you so much. And we definitely look forward to doing many more sessions with you all on many other topics. So please feel free to reach out to us.